Thank you for joining us again. My name is Jerome Fletcher. I'm an Assistant Chief Administrative Officer in the Office of the County Executive, or Mark Elrich, and we thank you for our latest Recovery and Revitalization Town Hall. As usual, we have a lot of good information that we want to share with our business community, hopefully in an attempt to help guide you through the turbulent times of the pandemic. As always, we start off with a new update, update on our new grants, and just want to put this in a little bit of a perspective. The grant programs that we've done as a county for our businesses so far have exceeded $70 million, and a lot of them are closed. We're in between that period where we'll actually have new grant programs that will come once the state issues its funding, and then we all know the federal government is also issuing funding. So there will be more grant programs to come in the future. So please stay tuned, prepared, and be ready. The one grant program right now that has recently closed is our second phase of the restaurant relief program that our partners at MCEDC has administered. That program serviced another round of $4.9 million. We were able to not only service another 100 new restaurant businesses, but we also were able to provide funding back to the original group that was in our phase one that received funding as well. So it was a very successful program. As we think about what our program should look like in the future, we are going to try to be a little bit more deliberate now that we've gotten past that first year where we were in a very reactive phase. We are now going to be asking deeper questions to see how we can help those businesses that are actually on the cusp of staying in business or not, because we really want to make sure that our resources in the future are going to help those businesses stay active and stay open as much as possible. So MCEDC, I believe their goal was to get all their funding out for that state program by the end of the month. I believe they have gotten all of their money out except for a small bit at this point. So they are moving ahead of schedule. They are very efficient. And again, we thank them as always for their partnership. Moving into our program, of course, we'll be joined first by Dr. Earl Stoddard, who is our Emergency Operations Manager. He is always the one who has his feet on the street, so to speak, as to what's going on within the county. He will provide us an update, and we'll take questions from the audience once he gives his report. Please remember to place your questions into the chat, and we'll get to them. And then we'll be joined by Judy Stevenson and our LEDC guests to talk about some legal guidance programming that we have upcoming as well. So with that, I will stop talking, and I will turn it over to Dr. Earl Stoddard. Thank you for being here, Dr. Stoddard, and we'll let you go ahead and give us a brief update.
Thank you, Jerome. So I'll start off with just a quick where we're at with COVID-19, the virus. Then we'll talk a little bit about vaccination, and then certainly take some questions. So we're averaging approximately 115 cases a day in Montgomery County over the last 7 days. Our test positivity is down to 2.83%, which is good. The state continues to track the spread of variants, both within the state, but also within Montgomery County. Nothing really too much new to report there. However, I do think it's important to recognize that the governor did announce a program where approximately 10% of samples will be tracked for the variants in testing partnership with Johns Hopkins and the University of Maryland Medical System. And so obviously that'll give us a good sentinel surveillance on how the variants were spread. As I think I've told this group and other groups, we do expect that those variants will begin to spread within Montgomery County and within Maryland. There's no reason to believe that we're somehow going to be immune from them. Right. They provide more benefit. They provide more. They're stronger in terms of their transmissibility than other strains that have been circulating, and so they have an advantage in spread and will do so. On the vaccine front, we're just short of 172,000 Montgomery County residents who have been vaccinated through all sources, which is excellent progress. That 16.4% of our population has received at least the first dose of the vaccine. 8.1% of our population has received both of their doses of the vaccine. We have been focusing on our 75-plus population up till this week. Approximately 73.1% of that population has now been vaccinated, which is just short of 53.5 thousand people. We believe we have about 73,000, so we'll continue to vaccinate in that group, but we are also adding on 2 additional cadres of individuals beginning this week. Those are our 1B essential workers. So that includes things like our childcare workers, public transit workers, our education sector, grocery store workers, individuals with developmental disabilities, individuals experiencing homelessness, and individuals in our detention center. In addition, we are also incorporating our adults aged 65 to 74 as well. Because other entities in Montgomery County have already been vaccinating the 65 plus population, we're actually already 40% into that population to start with. So that's, we're not starting from zero. There are about 90,000 individuals over the age of 65 to 74. And so we do have some progress that we need to make through those tiers, but we do, we are incorporating 65 and over as well as those essential workers that I described. We expect and are beginning to see the early signs of seeing an increase of vaccine doses becoming available to the state with the addition of the Johnson & Johnson vaccine. The county health department received 1,600 doses of the Johnson & Johnson. We began utilizing them yesterday and will continue to do so through clinics today and tomorrow. That is a one-dose vaccine, and in spite of what you heard, is very effective at preventing COVID-19 severe infection and death. There are no instances of someone receiving the Johnson & Johnson vaccine and ending up in a hospital or dying as a result of COVID-19. So when you talk about effectiveness, that's the ultimate, at the end of the day, effectiveness. It keeps you alive, and that's how we're going to use it. Mm-hmm. We do not expect to receive additional doses of Johnson & Johnson next week or the following week as the manufacturer ramps up. They've actually developed a partnership with Merck, which is another large pharmaceutical company, to jointly produce the Johnson & Johnson vaccine together, which will allow an expedited production of that. We are also hearing from Moderna and Pfizer that they are expecting additional doses to become available. Pfizer has said that by mid-March, so within the next couple weeks, they're going to go from approximately 5 million doses a week nationally to about 30 million doses a week nationally. And by April, Moderna expects to go from 5 million to about 10 million a week. So that is a substantial change in our vaccine availability, and is why President Biden has suggested that there will be an adult dose for everyone who wants one by the end of May. Mm-hmm. We hope that's the case, and we're ramping up our ability to distribute the vaccine as if it is. But obviously, lots of words can be said, but until we have vaccine in hand, we are optimistic. We're cautiously optimistic. And so I think that gives a lay of the land of where we are at now. We're working with the essential worker groups. And so if you're in one of those groups, you will be receiving outreach. Particularly if you're in one of the private sector entities like the grocery stores, you'll be receiving outreach to get those employees into the lists. It's going to be a multi-week process. There are about 150,000 people in the two groups that we're beginning to work into now. Some of them have already been vaccinated. So again, we're not starting from zero, but even if we say we're 50,000 in, that's still 100,000 more people in that tier. And, the state's getting less than that per week as a state allocation, let alone a county allocation. So we'll be in this tier for several weeks before we move on to our next tiers. And I'll stop there.
Okay, thank you, Dr. Starter. That was a lot of good information. And first of all, let me be the first to congratulate you and all of the other staff and entities that are providing the vaccine to those who need it as soon as possible. The supply and demand is always going to be a big conversation, but you sound very positive when you say that our supply is going to be increasing in the upcoming weeks, and hitting that target that the president put out there, to me, is important. And then it gives everyone a larger sense of comfort as we begin to move into other activities as the weather gets better and things move forward. Now, we didn't talk about reopening in that first segment, and I got a couple of basic questions. I'm not, asking you to, let the floodgates open. We're not Texas or, some of those other places, but there have been conversations about our thought process and what are we thinking about reopening. And I know internally we've had some very good conversations that have led us to know that what we're trying to accomplish based on what we saw from the fall and what we learned from that, and what we know that the vaccine will cover going forward. But there's still that area where we cannot just move as fast as anyone would want to, but we need to move very deliberately as the state will allow, because we can't open in front of the state, but then follow the state, follow our peer jurisdictions. Do you have anything you would like to say about us remaining patient as we think about reopening and some of those issues that come along with it?
Yeah, I would say a couple things. So first off, we're actively involved in a race, and I say the we as in the public health community of trying to vaccinate people, racing against these variants that are going to spread and become more transmissible. And I think the CDC has offered a lot of caution over the last several days about what we're seeing from national trends, particularly where the variants are spreading more rapidly. They are seeing the deceleration of the decline and starting the slow climb back up. So obviously we're concerned about that happening. And so I think this screening process the governor has set up with variants is going to be incredibly important to understand exactly where we are in that race in our neck of the woods. That said, the numbers have improved substantially. As the weather warms, we would expect the seasonality of this virus to help to work in our favor as well. I would expect that over the next couple of weeks, you will begin to see changes through the executive order process to some things. Just as we have talked about before, we are not going to make 10 changes all at once and rush forward. We are going to make a few changes, evaluate, a few changes, evaluate, a few changes, evaluate. I would expect the next things that you see to be some capacity around our gathering limitations. I would expect to see some things in our child care sector to align with the rest of the state. I would expect, potentially some youth sports activities to be allowed to proceed. But again, that requires that the county executive decide to move forward with those things and the county council approve. And so I'm not announcing anything that we're doing today, but I think that is coming soon. I think we're clear on that. Now, we are also beginning to have conversations. I know some of our live performance partners are on, and we know that you all need lead time for performances and things like that to move forward. And so we want to begin to we have quote unquote dusted off the plan that we had set up before the fall came along and the surge came along. And so we will be looking to move forward with giving you all some lead time on being able to do some of those things, hopefully over the coming weeks as well. This is going to be a very challenging time in the sense that, we are in that race, but I do think we're going to be in place. We may not be able to do everything we want to do by April, but certainly maybe towards the end of May or June, things will become increasingly more open over the summer. I do not think we're talking about even a summer like we had last year because of the tools, both in terms of vaccine and testing that we have available to us now. And so I would expect that substantially more activities will be allowed and expanded capacity over the summer. I just think we're 6 weeks, 8 weeks away from being able to really ramp those kinds of things up. So I think that's where we're at.
All right, thank you, Dr. Stoddard. And we, staff who intertwine with the business community on a regular basis, will continue to have those conversations, and of course, we'll bring information, comments, and concerns back to you and others so that we can hopefully address them sooner rather than later. And like we said, all be prepared when the time comes. All right, so we do have a couple of questions we want to get to from the chat. The first one says, I just spoke with the firm which the state brought the PrepMod system. The CEO stated that the state never asked for screening criteria, i.e. to screen by residency or eligibility criteria to avoid appointment error / wasted appointments. She also said PrepMod was structured for immunizations available to all equally, not screened. She said it is possible. Is the county aware of this?
Yeah, so obviously the state, so for those that don't know, the PrepMod system is the state system which all local health departments are required to utilize to actually not pre-register, but actually register when someone gets an appointment for a vaccine to get a clinic spot and track the numbers and all those things. So the PrepMod system is an excellent system for the exact scenario that the questioner suggested, which is an excellent system for an environment where you've got a lot of vaccine and people who want to get it and get vaccine to those people. It is not currently implemented to be able to screen out based on age or employment or any of the things that the state or the county have narrowed it down to. I believe, in addition, the way the system is set up is that if you send out a single link, 100, 1,000, 10,000 people can utilize the same link. One link to make appointments at a clinic. So if we have let's say we have 500 seniors that we're trying to offer it to. We send out 500 links to those 500 seniors. If one of those seniors takes that link and shares it with a listserv, for example,
Right.
The people on that listserv can take the appointments and lock out the other 499 people who got appointments and fill up all the appointments before they've had an opportunity to go in and take them. And so the state is working with PrepMod. It is a state system. On January 26th, I remember this very fondly, I sent to the governor's advisor, Executive Director Shu, a list of the things that we were asking for, which is clearly laid out in this question. We'd like it to be restricted based on type of, is it first dose or second dose? Is it who's receiving it? We wanted a single link to be able to be limited to one registration slot, all those things. And the state is working on those things. They've had a fix launched this week, and it seems to be working okay in some circumstances, less okay in others. So there's more work to be done there. But yes, we would like to see that fixed, and we have suggested to the state that they do so.
Absolutely. Great response. Thank you. This next question is one I think you probably hear multiple times a day, but it's kind of lengthy, so bear with me while I read it, but I think that it's very relevant. I was going to paraphrase it, but I think it's valuable to read the whole thing. So here we go. All right, my question pertains to the closing and now reopening of restaurants. Many of us in the restaurant community have had a terrible time in communicating to our staff and our patrons of when we will reopen and when we will increase capacity. This is of vital importance for staffing our establishments. We have been told in very vague terms that we are not at the proper metrics yet. We have requested from the CE and the council, what are the metrics for reopening? What are the metrics for 50% capacity? And what are the metrics needed for full capacity reopening? So what metrics is the county looking at to reopen, and why is there a lack of transparency on this particular matter?
A couple things. So first off, there are a lot of numbers that we look at. Some of them are shown on our dashboard. Others are not all there. And I'll go through a few of those to illustrate the challenges that we face. There are probably at least 10 to 15 metrics that we look at. If we were to set thresholds in every one of those and we didn't achieve all 15, I think that we'd be getting just as much criticism for where you set bad metrics because you're not getting to all 15, right? Right. So we try to give ourselves enough latitude to say, okay, we're seeing enough improvement in these 12 to move forward, even though we haven't achieved some threshold that we would arbitrarily set. Now, when we reopened indoor dining, for example, last summer in the beginning of June, we were at a case rate that is roughly 50% of where we're at right now. We were at about 6 cases per 100,000, and right now we're at just about 11. So one might suppose to say, well, why would we reopen indoor dining in light of the fact that our case rate is twice what it was when we opened it last time, and we saw an increase when we opened it last time? Well, what we've also assessed is that the amount of testing that we're doing has substantially increased as well. And that may explain in part the increase in the rate of cases. And so we could set metrics, but the problem is the metrics, that lacks context for what the metrics actually mean, because the case rate is the case rate. But if we know we're doing a lot more testing, that may also in part explain why the case rate is substantially higher. Oh, and so, do we say our case rate was, our test positivity was under 3%, and our case rate of 5 per 100,000 residents is what we utilized last year? We may not get to 5 per 100,000 residents for the next 3 to 4 months because of the amount of testing we're doing. So the tricky thing is if we set metrics that are just these metrics, we don't have any conversation until we meet them. I can almost promise you that in a month when we don't meet those metrics, we'll be being asked, well, can't we move the metrics? And so we're trying to give ourselves the latitude to be able to open things up before we achieve things if we see the right kinds of trends. But people see it as also the reason why, many people think it's because we want to keep everything closed, and therefore we want to keep the man behind the curtain and not explain exactly why it is. But I would suggest to you that the reason why we haven't set strict thresholds is as much because we're concerned about not meeting them for other reasons besides what's actually happening in the community, like the amount of testing we do, for example, in setting those metrics. So I know that the county executive heard from council that they have requested this. We are going to put out something to more clearly articulate where we'd like to go and try to explain a bit more about where we're going. But I caution you to suggest that if you want what you're asking for, which is a strict number that we open when we get to this number, you may not like what happens as a result, is my point.
Yeah, I definitely understand that. Sounds like it's you don't want it to be a yes or no conversation. You need some flexibility and latitude, like you said. So some decisions that can hopefully that will benefit the community are able to be made. You don't paint yourself into a box. The next question is regarding back to the vaccine, but it's about the state's vaccine equity task force. It says that the governor asked for a representation or for each jurisdiction. Do you know who that is from Montgomery County?
I actually don't know who we've assigned to it. I mean, equity has been such a big part of our conversation. It'd be hard to narrow it down to one person. I'd have to ask Dr. Gales or Dr. Kroll who they've assigned to be our equity officer. But when the state assigns equity officers at the local health departments, I think we're so far ahead of that because we actually have an equity strategy in Montgomery County that's working. Our health department clinics, approximately 46% of those vaccinated have been from our minority population, which is not perfect, but substantially better. Substantially better than where we were at in other venues, and so we are absolutely interested in having equity principles be clearly reflected in our vaccine rates, and we're seeing it more from the county level than we are from the pharmacies and other venues. We've shared that process and our framework with several of our hospital partners who are utilizing it at this point. So. I'll get the name for you, but absolutely, we're well into utilizing an equity framework in Montgomery County.
And the liaison to the state's vaccine equity task force will be a government employee. The second part of the question is, will we push for a non-government representation on that task force? Because over 150 community organization volunteers have been working with the state since the fall and have not been invited to engage on that task force. So it sounds like, this person is asking, how can we be more inclusive of not just the government voice, but the community voice?
Yeah, I mean, we definitely would like for that to, it is a state task force. We don't get to decide who's on that task force. I absolutely think that the non-governmental partners should be engaged in those. I also think that if the state's having an equity framework, they should be requiring every entity that receives vaccine to have their own equity framework as part of the agreement to even distribute vaccine. And so, yes, we can push that forward. That there are community organizations that would like to be in the equity task force. 100% support that. No question about it.
Okay. Is there a way that residents can help county leaders get a mass vaccination site in Montgomery County? If so, tell them how, and an immediate increase in mobile units and target areas. So they're looking the same thing you're looking for, which is to provide more vaccine as soon as possible, especially with a max site. But everyone may not understand why we don't have it, or if there's anything that can be done to get one.
This is decided in the governor's office. There's no other place where this decision is made. I could tell you Maryland Department of Health makes the decisions. That would be misleading. It is decisions around where the mass vaccination sites are made in the governor's office. And so if you're going to advocate to anywhere, it's got to be the governor's office. That's where we're advocating to. We've had multiple conversations with partners in the state. But ultimately, the decision on whether we will get one or not, or when. To be clear, the state has not said no. They have not said no, we will not give a mass vaccination site to Montgomery County. They've largely said we've got 3 more that we've planned out. It's going to take the 6 sites that we will be up to at that point will take approximately 30,000 doses. We'll be able to do about 30,000 doses a day. Until we have a more strong commitment from the federal government to provide more, we're not going to commit to a 7th, 8th, 9th, 10th, or 12th. And so they have not said no, but they're saying we need more vaccine in order to go beyond the 6 that we've currently got planned. And they've been in development. It takes about 2 months from their perspective to develop a mass vaccination site. We're way into that already. We've got a clinical partner identified. We've got several venues that are options identified. So certainly advocate to the governor's office. That's where we're advocating to, and we'll continue to do so.
All right. Sounds good. How closely do you work with the DC mayor to create reopening policies?
Yeah, so Dr. Gales, our health officer, talks to Dr. Nesbitt, the DC health officer, on a regular basis. I know DC has been pretty committed in the conversations that we've talked to them recently that they're going to hold fast until mid-March at least to get these variants and get, push more vaccine, get these variants under control. And so we do talk to them, we are certainly much more inclined to be in line with the regional partners if we can get there. And so I would expect that will be an ongoing effort as we get vaccination rates similar to theirs up. So, they talk on a approximately a weekly basis with the DC health officer, and then the regional health officers, state health officers talk every Monday, as well as the regional health officers across the national capital region, so including Northern Virginia, talk about a bi-weekly basis.
Okay, thanks. That's a good one, because we know that regional collaboration is important so that, Montgomery County is not lagging to the point where people can just drive easily to another jurisdiction, and then that increases health issues as well as economic issues as well. Last question, Dr. Stoddard, is have the statistics shown any adverse effect from the reopening of the dine-in? We've been told that it can take 3 weeks to see any effects from change in policy. If the downward trend continues, how long before restrictions are eased in the county to more align with surrounding jurisdictions? So I think we pretty much answered that one, but.
Yes, so we look at the contact. So COVID Link is the state contact tracing data, and in that they ask you people who are positive what you've done in recent weeks, and what we've seen is, and also what your employment status is. And so, for example, as we vaccinated healthcare workers, we've seen a precipitous drop in healthcare worker infection rates, as one might expect. Mm-hmm. What we do see, and I pointed this out to the team earlier this week, is so when we closed indoor dining, the contribution of people who had said they participated in indoor dining immediately following immediately preceding their COVID-19 diagnosis got down to about 6 or 7%. And so that was people who were traveling outside of Montgomery County to where it was still open and participating in indoor dining, and not saying they were infected necessarily in indoor dining, but that was one of the activities they participated in. It was approximately third or fourth on the list, or it dropped to about fourth or fifth on the list at that time. Mm-hmm. We have seen a little bit of an increase. We're up to about 16% of cases right now. Is number 3 on the list after retail and those who work outside the house. Working outside the house has been and continues to be the most thing that's most associated with people who test positive. 16% indoor dining, and that's an increase. It's increased each week essentially since indoor dining is reopened. It was about 12% last week. It's 16% now, so that's something we're paying attention to. It is still substantially lower than retail, but obviously retail's a very large bucket of activities. Sure. And so we have not seen a massive surge in contribution of indoor dining, but we are seeing an increase relative to when indoor dining was closed. I think I do think you will see capacity limits before you see a great broadening of the activities. I don't want to make a promise about indoor dining. I do know that this is an area of conversation that we're having, but I think that I don't have much more to add other than we are kind of monitoring those numbers to see how high does that percentage go. I'd like to see it flatten out before we move forward to say, this is where we're at with 25%. But obviously, it's been 2 to 4% a week increase since we opened indoor dining in that contribution. Again, not asserting necessarily that people are always getting infected in those cases. I want to be clear about that. This isn't when we do contact tracing, we roughly know 5% or less of where definitively someone contracted COVID-19 because community transmission is so broad. Okay. I can say this person participated in A, B, C activities. I don't know if it's activity A, activity B, or activity C that was where they got infected, but they're getting infected somewhere. And so we only can look at what activities are most commonly associated with people who get infected. And that's sort of the way the state has worked. And so.
No, great answer, great explanation, and makes total sense. And again, that question about, reopening and relaxing restrictions, we're going to have to be a little bit more patient as we continue. But I'm glad the conversations are happening in earnest, and they're happening right now. those were some great questions and even better answers. So as always, thank you, Dr. Stoddard. We appreciate you taking the time out and being here. The community is better for you at what you do, and the business community thanks you for your assistance to them today. All right, so our next person that we are going to speak with is Judy Stevenson. She is our small business navigator. There she is. She provides a lot of oversight, assistance, support, and what I would call authentic leadership to the group that she handles. She is very passionate, and she's been a county employee for quite some time, so she knows the county extremely well. Judy, how are you?
I'm good. Thank you, Jerome.
Thanks for joining us.
You're welcome. Thank you for having me. So the first thing I want to say is that we were going to have Marla Balanik, the CEO and Executive Director of the Latino Economic Development Center, with us today. We've had some technical problems, so I'm going to channel Marla and tell you what she was going to say. But just to provide some context, Montgomery County has been hearing for some time from small businesses that they're having extensive issues, legal issues, and they need assistance addressing some of those legal issues. And we've heard this, and as a result of that, we have explored a partnership with the Latino Economic Development Center to provide legal services to the business community. Now, this is not something that the county has traditionally provided to the business community directly, and honestly, we don't want to provide it directly because of privacy issues on the part of the businesses. So we are partnering with this third-party organization, the Latino Economic Development Center, to provide a pilot program on legal issues for the small business community. So LEDC, if you're not familiar with them, they are a very strong partner with Montgomery County in terms of providing technical assistance. They're a community development financial institution, so they provide lending. They work with Montgomery County on a microloan program, technical assistance training. So they offer a full suite of assistance to the local business community, and that's exclusive. Even though the name is Latino Economic Development Center, they provide these services throughout the community to any business that needs them. So with this particular program, they will be providing legal support around a variety of topics. One of the biggest that we've heard from small businesses is leasing, rent issues. So that will be one of the topics that will be addressed in the program. Renegotiating contracts with vendors, clients, possibly even with employees, depending on what the relationships are. Renegotiating loans. Sometimes businesses will need to talk to their lenders about, the impacts of the pandemic. There's insurance concerns. Some businesses have different types of insurance that could help cover the cost of these types of pandemic-related issues. And they'll also just deal with legal issues of starting and closing businesses. So in hard times, we know that businesses will be closing. There are best practices for closing that limit the negative impacts to a business. So that could be part of what would be discussed. But also there are going to be businesses that are opening, and we want to make sure they have a strong foundation. So in this pilot program, we're going to alternate between webinars and then legal clinics. The webinars will cover a variety of topics, and then the clinics will allow businesses an opportunity to meet 30-minute one-on-one sessions with a legal expert. They will be matched, so LEDC will do some screening of what the business needs are, so that they will be matched with a legal resource that can actually address those specific needs. So clients, when they do sign up for a session, especially for the clinic, they need to be specific of what their issues are so that we can make sure they get the right legal assistance. Attorneys will be providing support and guidance. Realistically, you shouldn't expect to have a whole issue resolved in a 30-minute consultation, but you should be able to get some direction in what the legal considerations would be. Any future engagements that happen between the clients and the pro bono attorneys is outside the scope of this program. So if additional consultation is needed, that would be worked out with the attorney, between the attorney and the client.
Mm-hmm.
So LEDC has done this in other locations. They are doing this in DC currently. So they actually have a track record and will be able to jump into this program with both feet. If the program is successful, we will be exploring ways to extend it into the next fiscal year. Right now, the objective is to provide one session a month between now and June, which is the end of our fiscal year. So we can at least test the program and see whether it's successful and what the reaction is and what we can do going forward. So we do have a point of contact at LEDC who is Javier Rivas, and we have an email address for him that I'm hopeful can be put in the chat so everybody can see it. It's jrivas@ledcmetro.org. And if anybody needs that, if we can't get it into the chat, then we will be available to provide it.
Thank you, Judy. That was a lot of great information. And first of all, let me thank our partners at LEDC. They have been with us and supported us and partnered with us throughout this pandemic on several initiatives. So we thank them for continuing this in the line of legal services, because a lot of businesses don't have that access to a lawyer or someone who can provide them guidance readily. So this should be a very successful program. Do you know, you said, they will be signing up. So I'm assuming, do you know at this point they'll be signing up virtually online? There will be a website that will be created and slots will be open and people will be joining that way. Is that?
Yeah, so I'm not sure we've worked out all of the details, but yes, I would expect there to be an online sign up, or you can contact Javier, who will provide some guidance, possibly even sign people up. I'm committing him to something that I don't know that he's committing himself to, but
I do it all the time.
As soon as the specifics are available, we will have, I'm sure LEDC will have information on their website. We'll have information on the Montgomery County Business Portal, which is just montgomerycountymd.gov/biz, B-I-Z, and we'll have information there as well.
Okay, and I'm pretty sure capacity is not unlimited, so people need to be very, quick to take advantage of this process. We were not able to make it as large and as wide as we wanted to, and that was a funding issue. But I'm glad that you were successful and able to get it started, at least on a pilot program where we can hopefully see the value of it. And if we get that piqued interest in it, then maybe that will trigger some of our county leadership to find funding to continue it in the future.
Right.
I don't see any questions in our chat related to our program, so I'll give them another second. But from my standpoint, and while I have you, and this was another thing I thought of when you were talking about that, the For Business Advancement Center, which you are heavily involved in, which has sort of what I would call morphed from the prior Business Solution Group programming, Business Connect that we did. Can you talk about that for a minute, and maybe either what the For Business Advancement Center has morphed into, or the vision that you see that will occur as you guys continue to keep moving that project along?
Yeah, so before the pandemic, we had been implementing a Business Connect program, and the concept was to deliver business services through our regional offices closer to where the businesses are. We were in the process of launching the last of these in the Mid-County Regional Center when the pandemic hit. Mm-hmm. So I think what will happen, it's kind of a mixed bag, because really, because of the pandemic and all of this technology we're using, really, we have immediate connections with businesses anytime they need help. So. Sure. It's almost even a more direct connection than being in the regional centers, right? But I think that what we're looking at is ensuring that our programming going forward will maybe be a little more in depth than what we've been able to do in the past, because we do see, just an example is these legal services are really critically needed And so maybe our focus changes from a general training on starting a business to a more focused training in depth or even consultation. So I think that the program itself will morph. I should also mention that on the business portal, there's a for business assistance request form. So again, you can fill that form out and ask for specific assistance. And the other thing I want to mention, because I think people just don't know this, LEDC is one partner of ours, but we have a network of resource partners that offer training and consulting and mentoring and all kinds of assistance that is available to our business community and can be accessed through that assistance form. So if they fill that out, it's not necessarily that somebody at the county is going to provide direct assistance, but we will connect them with other organizations that can provide that assistance.
Absolutely. And being that conduit for the government is very important, because the government is not the answer to every question that exists. But hopefully we can get you to someone who has an answer or help your situation a little further along than it was before you got here. So here is a question regarding legal services. Can the name of this particular legal assistance program be made broader or more generic? Everyone rightly hears Latino as being focused on that population. So I don't think Latino is in the name of the program description. It's just in the name of those who we partnered with to actually provide the service. Do you have a technical name for the?
So the working name is the Small Business Legal Assistance Program, but the acronym for that is just kind of not great, but.
Okay, but still, it goes to this viewer's point of making sure that it doesn't sort of just pigeonhole one segment of our population, which is an important segment, but we want to be as broad and inclusive as much as possible. But
absolutely,
the vendor is the one who we were able to partner with, and there's not a line around the corner of vendors who want to partner, so we have to take resources where we can find them. All right. It says, would you be interested in starting a minority business development center in Montgomery County? There's a grant opportunity due on 3/17, and I would love for minority business leaders to partner with your organization to bring it here.
So if you want to send, I don't know, how do I get contact information? Davis.
This is from Valerie Davis at Contact Pros LLC.
Yes, I don't know how we make it. I guess I could say if you go to the Montgomery County Business Portal, my contact information is there, and you're welcome to reach out to me directly under contact.
Okay. Yeah,
I'd be very interested in learning more about it.
Yeah, that sounds like a great venture if possible to get it done. Judy, thank you as always. You and I could talk all day. I appreciate your support and your, more importantly, your passion and your work ethic. If you don't know Judy Stevenson, she's an asset to the county. We're glad to have her, and I'm fortunate to work with her on a regular basis. Judy, thanks a lot. We'll get you out here on that one.
Thank you.
You're more than welcome. And everyone else who participated today, we want to thank you for joining us. Our next meeting will be on March the 19th. We will put out information on who our guests will be prior to then, but I can guarantee you that we'll have more updates from our doctors and our subject matter experts, as well as information that you should find useful as we continue to recover together. So until we speak again, I want to thank you and have a great weekend.
We can do more. Civic groups, we need you engaged to actively participate in the awareness